This is about my next step in trying to deal with cancer. It is the 30th of April, a Sunday. I'm at home alone. My wife and daughter have gone out to look at flowers, and my son's playing in a park. So it's a good time for me to be making videos. So my next step is intensive immunotherapy. So an intensive burst of immunotherapy. And I'm going to explain what that means and why I'm kind of trying it, or why I want to try it. So I've been having immunotherapy kind of once or twice a month, basically partly when the money comes in from the very generous donations that everyone's been making. And also because I generally have chemo twice a month, and immunotherapy works best kind of in between like the chemo sessions because if you have it sort of just after chemo, the chemo kind of destroys your immune system. So if you have it just after or just before chemo, you're going to basically, the chemotherapy will probably destroy a lot of the immunotherapy cells that are in your body. In my type of immunotherapy, which is autologous immune enhancement therapy. So that may be what's been keeping me alive up to this point. Along with the hypothermia therapy and the chemotherapy and the molecular targeting agents. But the immunotherapist is kind of recommending trying this intensive immunotherapy, which is the same immunotherapy as I'm having, but having it very intensive. I think having it be 6 times in the course of a week or two, plus the other immunotherapy I have, which is called dendritic cell therapy, which is a type of cancer vaccine. So it's trying to teach your immune system to attack the cancer directly. So again, having that 6 times, which is going to be nasty because it's actually quite painful to have it. It's so stupid, but it's just injections. But the injections are really painful because, like instead of kind of injecting into a vein or whatever, they put the needle at an incredibly shallow angle. They put it, for some reason, kind of the ribs thing, like the kind of into the flesh on top of the ribs, and I think they're kind of injecting into the lymphatic system. I think the reason for that is that if you inject it into the blood, maybe it kind of goes to the lungs very immediately and then kind of spreads out through the body, and you kind of lose some of the effect or something like that. There's some seems to be some genuine medical reason why they need to inject it in such an incredibly painful way. I mean, I have blood tests all the time and injections all the time, and it's just a non-issue. But these ones, I mean, they put this thing they call pain tape. So they put pain tape on where they're going to inject for like half an hour, whatever. So that kind of puts local anaesthetic in there. They sometimes use this kind of strange vibrating machine that uses near infrared or something to kind of like try and numb the flesh as well. And still, it is incredibly painful. Fortunately, only for a short time, while they're doing injections and a bit after. But anyway, that was a completely unnecessary digression, I've just realised. But still. a fun-filled life of dying of cancer. So the immunotherapist is recommending this intensive immunotherapy well, I say just, but I shouldn't say just because, but because for some reason it seems to be getting better results in some of the patients compared to the normal immunotherapy, so every few weeks. I think what happens is when people come to the immunotherapy clinic, maybe from abroad or just other parts of Japan, who have terminal cancer and can't stay very long, obviously the immunotherapist just tries to give them the immunotherapy as kind of as much as possible in that time. And those people seem to be getting good results. I guess it's something like that. So my immunotherapist, who's sort of called like the father of immunotherapy in Japan, he's been doing it for quite a long time and it's had like 10,000 patients. So unfortunately, those are 10,000 patients, not 10,000 patients enrolled in clinical trials. So it's hard to kind of get a kind of a robust grip on what that really means, what the results really mean. But I think, my immunotherapist, Dr. Telenuma, who he's a medical doctor. He's also a research scientist and biotech engineer. Extremely smart guy. So I think it's worth listening to him, really, when he kind of believes that it works intensively. He doesn't have clinical trials and stuff to prove it, and doctors are fooled. Just as much as, well, no, maybe not as much, but they still suffer from confirmation bias and this kind of thing, systematic bias. But yeah, I think it's worth listening to in this case. So this is not with a view to curing the cancer, because that's not going to happen. But it may extend my life and keep the symptoms under control. I know I look terrible in this video, but there's no kind of yellow on my face from jaundice or anything. My liver's still working okay, even though it's riddled with cancer. The PET scan I had recently showed that the don't seem to have cancer in the lymph nodes at the moment. So before I did lymph nodes in my abdomen, there's a lot of cancer there. The surgeon took out as many of the lymph nodes as he felt was safe. If you take out too many, then the lymph can't drain back into the bloodstream, right? So you get swelling and pain, and it's dangerous. But after the surgery, there's still cancerous lymph nodes there, or rather, still some lymph nodes cancerous. And the recent PET scans seem to show that that's no longer the case, which, in the grand scheme of things, doesn't sound such a big deal, but at least it's, it's certainly not like progress, but at least the cancer's not progressing through the lymphatic system, or at least not in a way that can be measured at the moment. So, the immunotherapy is very, very important, and hopefully having it intensively in May might make a difference. It might give me a few extra months, and if I have a few extra months, and that happens a few times, then that's that could be a really big deal, because I'm literally race against time with the new immunotherapies. Actually, these like checkpoint inhibitors. Yeah, if I could live long enough to try them, then I'd be in with a bit of a chance of quite significant life extension. So that's what's happening in the world of Karamoon's cancer nightmare. And I'll do some more videos on my kind of plans of what I want to do, because I really do want to find a way of promoting low side effective but partially effective but low side effect treatments for kids with terminal cancer, because people don't know about them and they should. I think it makes sense to do that. So some videos on that in the future. Having this intensive immunotherapy is going to cost about $20,000 or something, I believe. If you could share my fundraising link, which is www.matthewdons.org, matthewdons.org, that would be much appreciated, because I'm going to need a bunch of money for this treatment. Okay, thanks a lot.